My name's Kudzai Kanutu. I am a doctor working at Royal Melbourne Hospital and CoHealth. I have two titles, Infectious Diseases Physician and Deputy Chief Medical Information Officer. I work in clinical care as well as health IT. I have the opportunity to work with people who have infections. So if you can catch it or if you can pass it on, I can help. Alongside seeing patients who are unwell with various infections, I have been working on systems and processes that will allow patients and their families to better engage with their care through telehealth, video conferencing for healthcare, and also apps and mobile device-led initiatives. The main project we're working on is a video interpreter project. So seeing how we can integrate video interpreters into home-based care. We want to achieve equity and comparable health outcomes for our cultural and linguistically diverse patients. My goal with this project would be for our staff to be a lot more confident with using interpreter services, and also for the patients and their families to be a lot more confident about advocating, because often people don't feel like they have that agency to say, I would really like to have an interpreter in the room. The ways in which I think the work that I do and my team does will contribute to a better future is that as a healthcare practitioner, your motivation is, how can I get people to live healthier lives and give them the tools and resources they need to do to look after themselves and also to navigate healthcare, because healthcare navigation is really challenging and at the best of times, and worse still when you're sick. I want my patients to be the fiercest ever. I want them to be able to turn up anywhere and command the room, and for them to walk away feeling happy and feeling confident and empowered to then go about their life. The importance of everyday Victorians being involved in science is really laid bare in the current pandemic. I think there's a really undervalued aspect of citizenship science where people should be able to ask questions. You don't have to be a nuclear physicist to ask, questions about how the universe works. The more people get engaged, the more it informs things that are funded for study and funded for research, and the more we as scientists and researchers can actually come to terms with researching on behalf of community. What I think the community can expect to get more of from science is bringing people in and explaining things in plain language. And I'd really love for the community to start seeing more scientists who are really good at communicating in different ways to allow people to tap into science in a way that they can relate to. The role that leadership and particularly Parliament can play in helping us to build a better scientific future is they're in a position to direct what happens next. They're in a position to hear from scientists to help them inform what the next policy angle would be. For this Possible Impossibles forum, I would really encourage Victorians to come, participate, challenge, question, and I'd be really excited to receive questions from you all about all aspects of science, medicine, technology, and even culture. Hope to see you there, and look forward to being involved.